Stay-at-home orders during COVID forced some domestic violence victims to spend more time with their abusers.
But the NBC 10 investigators learned that finding out whether that increased the problem isn't so easy. Investigative reporter Claudia Vargas analyzed the numbers from different sources to see the coronavirus's impact on domestic violence.
And if you or someone you know is in an abusive situation, we're putting the National Domestic Violence Hotline number on the screen throughout this report.
He's punched me in my back repeatedly. He's picked me up, thrown me, choked me.
We've agreed to conceal this woman's identity so she can tell her story of domestic abuse without fear of retaliation. After the pandemic started, she says her husband's violent abuse escalated and became more frequent.
Maybe every other day.
They were both unemployed, stuck in their home with their children, going to school virtually.
There's a lot of stresses. You know, you got bills, you know, unemployment.
The abuse was about to get worse.
He's pulled a machete, said he was going to chop me up.
Advocates for domestic violence survivors say the pandemic made it hard for some victims to seek help, either because they couldn't get away from their abuser to call, or they weren't going to public places and seeing family and friends who might be able to help them.
For some people, we were worried it was a death sentence.
Lori Sawensky is the director of Turning Points in the Lehigh Valley, an advocacy organization that provides shelter and services to domestic abuse victims. During the pandemic, her group partnered with community food drives and grocery stores to pass out flyers with the domestic abuse hotline number and other resources available.
We definitely saw the volume of calls start to pick up.
Turning Point's hotline covers Lehigh and Northampton counties. They received nearly 1,200 calls from April to September, a 40% increase from the same time period the year before. However, 911 calls for domestic incidents in Lehigh County went down during that time period from 3,200 in 2019 to 2,800 this year. Hotline calls, 911 calls, and protection from abuse orders are all kept by different agencies. We thought if we took a look at all the data, we would know whether there was an increase in domestic violence since the pandemic began. But just like in Lehigh, other counties saw hotline calls go up or down, while the 911 calls did just the opposite. And protection from abuse orders went down across the board, but only by a little.
It is so up and down. There's nothing that was really consistent.
Sarah McMahon studies domestic violence and is the director of the Center on Violence Against Women and Children at Rutgers University. She expects that anecdotal stories from survivors will eventually give us a better picture of what domestic violence was like during the pandemic.
Reliance on reports that are made to formal sources are not giving us the full picture.
As for this survivor, she was granted a protection from abuse order in August. She called one of the hotlines, packed her bags, and took her kids with her in hopes of a better life without her abusive husband.
I feel like I can breathe.
Besides the state of Delaware, which only does it once a year, no one is looking at 911 calls, hotline calls, and protection from abuse orders together. Advocates say doing so could help find trends and problem spots. For the investigators, I'm Claudia Vargas, NBC 10 News. Count on it.
Their injuries shocking even those used to seeing it all. We're talking about domestic abuse survivors being treated by nurses during this pandemic.
The NBC 10 investigators found that hospitals do not keep track of domestic violence cases. Investigative reporter Claudia Vargas explains why one nurse calls it the industry's dirty little secret.
And just before we get to that report, if you or someone you know is in an abusive situation, we are putting the National Domestic Violence Hotline number on the screen during Claudia's report. Here it is.
If a victim of domestic violence comes into Abington Hospital's emergency room, Karen Doherty and her team of forensic nurses will take the lead. The forensic nurse examiners take pictures of injuries and collect information and any bodily evidence. They usually get a handful of cases a week. But when COVID struck and stay-at-home orders were put in place, Doherty says victims stopped coming in.
The fear of coming in and being contracted with the virus was a bigger fear than actually living with the violence.
Starting in June, once stay-at-home orders were lifted, the volume of domestic violence patients at Abington increased.
We saw a lot of facial injuries as well, with an increase in strangulation, which we know is one of the deadliest forms of violence.
In total, Doherty says, by her own count, her team saw a 10% increase in domestic abuse cases in the ER. The hospital itself, like most throughout the region, doesn't track domestic violence cases.
It's that dirty little secret that we still want to keep hidden underneath, and as long as it stays underneath, it's going to stay there, right? It's never going to go away.
So even medical professionals are still sort of sweeping it under the rug?
Yeah. Yes. There's still a lack of knowledge among medical professionals as well.
For their part, Abington says they have an on-site social worker who also works with victims and keeps her own statistics.
We checked with several hospitals in the region to see if they're tracking domestic violence. Cooper Health in New Jersey says they don't, but Christiana Care, similar to Abington, does. No other hospitals responded.
Christiana Care also has a team of forensic nurses who keep their own stats. Between March and June of this year, Christiana had 34 more domestic violence cases than the same time last year. We requested interviews with the hospital associations in Pennsylvania, New Jersey, and Delaware to discuss best practices in tracking domestic violence. All three declined interviews but sent us emailed statements. The Hospital and Health System Association of Pennsylvania says in part, the hospital community stays abreast of recommendations like that of the American College of Obstetricians and Gynecologists and works in partnership with the State Department of Health on key public health priorities such as intimate partner violence. The New Jersey Hospital Association spokesperson says in part that the state requires domestic homicides to be tracked and reviewed. She also says that New Jersey hospitals are also required to report to state police any injury caused by a firearm or explosive device. But we checked and there isn't a domestic violence subcategory for those reports. The Delaware Healthcare Association says in part, every patient who comes to a Delaware emergency department is screened for domestic violence. Domestic violence victims are then met by a case manager, social worker, forensic, or behavioral health nurse who can offer targeted resources to meet the patient's needs. However, the association says Delaware state law doesn't require hospitals to track those screenings, a point that was echoed by Christiana Care. Sarah McMahon studies domestic violence and is the director of the Center on Violence Against Women and Children at Rutgers University. She says domestic violence screenings should be done beyond the ER.
It's important for us to be able to then tailor and design effective prevention and intervention strategies, and the healthcare setting provides one of those places.
But she points out there has to be a strategy to domestic violence data collection.
Just checking off whether or not someone said yes or no is not actually helpful.
Back at Abington, Doherty says that some domestic abuse may never be counted and tracked.
What happens behind closed doors is just that, behind closed doors, and it often goes unreported and unseen, even by some of your closest friends and family.
For the investigators, I'm Claudia Vargas, NBC 10 News. Count on it.
Domestic abuse is not just physical. Survivors are threatened with deportation, loss of their job, cutting off child support, among other threats. Advocates and victims tell NBC 10 and the investigators COVID-19 made things worse.
Yeah, investigative reporter Claudia Vargas has that story. And if you or someone you know is in an abusive situation right now, we're putting the National Domestic Violence Hotline number on the screen throughout this report.
He even told me at the beginning that I shouldn't be getting a salary because I was the wife.
That's a woman we are calling Kate. We're concealing her identity so she can discuss her abuse without fear of retaliation.
A very abusive situation when it came to work.
She had a job but didn't have access to her money.
We had a joint account for a little bit, but the money that I put there, he took it.
Domestic violence advocates say the type of financial control Kate experienced is common in many domestic abuse victims.
Financial abuse is probably the first thing that happens in abusive relationships, where the abuser like, oh, I can handle this. I'm good with money. I'll control it.
Gina Ridge oversees the domestic violence shelters and programming for South Jersey's Center for Family Services. She says the abuser's control of money might sound nice at first, but it can be destructive.
It turns into a power and control thing where many survivors who have been working do not even have any money because the abuser has taken it all.
Once COVID-19 struck, Kate says her husband's abuse grew more forceful.
The pandemic made it even worse.
Kate is an immigrant. She says her husband threatened her with deportation and refused to sign her immigration documents.
He was threatening me, blackmailing me with it, and he actually never signed it. So I had to get an immigration lawyer and apply for a waiver.
Kate sought help at Turning Points. It's the Lehigh Valley's domestic violence advocate. The group's hotlines have been blowing up since June. Turning Point's Lori Sawensky says the majority of calls are from survivors experiencing emotional and financial abuse.
The amount of stressors people normally experience in abuse are astronomical. And then you put a pandemic on, and it just made it unmanageable for so many people.
Sawensky's team connected Kate with counseling and a divorce lawyer.
I'm very happy.
Kate has since gotten a new job and opened up her own bank account. She is still waiting for her permanent residency to be approved. For the investigators, I'm Claudia Vargas, NBC 10 News. Count on it.
And if you need help getting out of an abusive situation, you can go right now to NBC10.com/domestic violence. We've included there resources to connect you with advocates in Pennsylvania, New Jersey, and Delaware. You'll also find information on domestic violence cases during COVID-19 throughout our viewing area.
State lawmakers are planning legislative change following an NBC 10 investigation. Legislators in Pennsylvania and New Jersey say changes are needed in domestic violence laws. NBC 10 investigative reporter Claudia Vargas has more on the potential changes.
We cannot successfully address anything that we don't know about.
Pennsylvania State Senator Art Haywood is reacting to the NBC 10 investigators report on domestic violence. We found that most hospitals in the tri-state region do not keep or report data on domestic violence, either the number of survivors that come through the doors or the type of injuries. State laws don't require them to do so.
Hospitals not having a record of incidents means that we are that much less prepared to address domestic violence.
Haywood is echoing what we heard from the head of forensic nurses at Abington Hospital and one of the people who raised the issue of hospitals not tracking domestic violence cases.
It's that dirty little secret that we still want to keep hidden underneath, and as long as it stays underneath, it's going to stay there, right? It's never going to go away.
Nurse Karen Doherty's team keeps its own statistics on the number of domestic violence victims they treat. Haywood plans to introduce legislation in the spring that would require some uniform data collection system for hospitals.
I'm going to talk to some of my colleagues about how we can adopt this legislation that would address what you found. I can't thank you enough for finding it.
On the other side of the state, Pennsylvania State Representative Natalie Mihalik says she plans to meet with hospital officials and perhaps hold a hearing.
Hey, is this something that, you're willing to do? What is the best way for, this to be implemented? What is the additional, manpower behind it? And what's the cost on the healthcare systems?
She believes tracking data on domestic violence is helpful in responding to the problem and preventing abuse. But she sees some challenges with asking hospitals to keep stats.
A lot of times victims are just reluctant to either, admit or, tell somebody that they have been abused.
The Pennsylvania Hospital and Health System Association tells us it is taking a deeper dive in examining the issue raised in our report. Across the river in New Jersey, State Senator Joe Vitale is also adding domestic violence legislation to his spring agenda. Vitale says that since the NBC 10 investigator story aired, he's been speaking with domestic violence advocates.
They know what the best practices are, and they know what it is that we should do going forward.
We checked with the New Jersey Office of Domestic Violence Services. Its spokeswoman says they support efforts to better identify and quantify domestic violence incidents, as long as the victim's confidentiality is protected. Vitale says he will follow the advocate's advice.
We'll draft legislation, we'll have a hearing to discuss them, and then likely vote them and move the process along.
The New Jersey Hospital Association responds in part that documenting cases of domestic violence is a nuanced and sensitive issue that first and foremost must respect the individual's wishes and privacy. The association says it is committed to working with state lawmakers on the matter. For the investigators, I'm Claudia Vargas, NBC 10 News. Count on it.